Did you know that there are people who can have urinary incontinence when they have sexual idea? Hi, my name is Castro-Arias. I'm a urogynecologist from Universidad de Concepcion, Chile, and I'm going to present this study called Prevalence of Urinary Incontinence During Sexual Activity in Persons with Vulva, More Than We Think. This is a self-funded study with no financial affiliations to declare and no conflicts of interest. Urinary incontinence during sexual activity is named by ICS and IUGA as coital incontinence and refers to the leakage of urine that occurs during or after vaginal intercourse. Its prevalence is variable and depends on the definitions used, the population study, and the measurement tools. According to several publications, it can range from 2 to 55%, being more frequent in women with other types of urinary incontinence. Usually, two forms are recognized during penetration and orgasm. However, there are some isolated reports that also describe during foreplay. Traditionally, incontinence during penetration has been associated with stress urinary incontinence and incontinence during orgasm with overactive bladder. That said, it is clear to us that vaginal penetration is only one of many sexual practices, which is reflected in a lack of studies reflecting this wide diversity. We also know that sexuality is not limited to cis and heterosexual people, so this phenomena can occur to anyone, and sexually diverse populations should be incorporated into the populations studied. The aim of this study is to determine the prevalence of urinary incontinence during sexual activity, UIDSA, in a population of persons with vulva. Methods. This is a cross-sectional population-based study, online survey, self-administered, applied between December 2020 and January 2021, which was distributed through social network. Incontinence Severity Index and ICIQ-7 validated in Spanish, sociodemographic survey and question regarding UIDSA validated by a Delphi group were used. The inclusion criteria was persons with vulva, women, trans men, and non-binary persons over 18 years old from Provincia de Concepcion, Chile. It was approved by the Ethical Scientific Committee. An analysis of absolute and relative frequencies with SPSS software was made. UIDSA was defined as the involuntary leakage of urine during any type of sexual activity, including masturbation, sexual ideation, foreplay, vaginal or anal penetration. For this study, we use the term UIDSA, which means urinary incontinence during sexual activity, as it seems to us to be much more representative than the existing term coital incontinence. In Spanish, we call IODAS. Results. 1,114 persons with vulva agreed to participate in this study. The mean age was 28.8, with a range from 18 to 71 years old. 93.7% recognized their gender identity as female, 4% as male, 1.7% as non-binary, and 0.3% not conforming or not defined. In terms of sexual orientation, 80.9% defined themselves as heterosexual, 11.8% as bisexual, 2.7% as pansexual, and 2.1% as lesbian. Other sexual orientations can be seen in the graphic. When we ask about urinary incontinence, 23% of the respondents report episodes at least once a month. 18.6% respond that they had had episodes of UIDSA. Of this group, 37.2% also had some other type of urinary incontinence at least once a month, and 21.3% had only UIDSA, which we call exclusive UIDSA. When we ask about the time of sexual activity when incontinence occurs, we consider sexual activity alone or with another person. 62.3% at orgasm, 54.1% during penetration, either with the penis, toys, or hands, 30.9% during masturbation, 28% during foreplay with a partner, 10.6% during sexual ideation or when having erotic fantasies, and 4.8% during anal penetration. 32.4% of this group report presenting the symptom more than 1 year ago. UIDSA is a phenomenon more frequent than we expect. A strength of this study is that it analyzed a general and sexually diverse population. This phenomenon can occur during any sexual practice and should not be restricted to heterosexual vaginal sex, but to the entire spectrum of sexuality. For this reason, we believe that the term coital incontinence is insufficient and biased and should be replaced by UIDSA that contemplates this diversity. We now have an exclusive UIDSA data that did not exist and that affects 1 in 5 people with vulva with any type of UIDSA. We do not know the pathophysiology of this phenomenon, and it seems to us very superficial to associate it simply with stress or overactive bladder. We believe that UIDSA responds to other mechanisms and this should be investigated. Thanks for your attention.